This month, July 2023, we are offering free vet checks for any lumps or bumps that your pet might have. When we are checking for lumps, it involves feeling the entire dog's body. Lumps can form in the skin, lumps can form in the fatty subcutaneous layer, lumps can form on the muscle, lumps can also form on the bones, lumps can form pretty much anywhere. So whenever we're doing these checks, it's really important that we feel the whole of the dog so that we can ensure we find any lumps or bumps that we might be worried about. So when it comes to actually defining what these lumps are, it's very, very difficult to do that by look. There are tumours such as lipomas which look very, very similar to mast cell tumours, which are actually very nasty skin cancers, whereas lipomas are benign masses, so they're not cancerous, they won't cause any problems. So this is why we recommend having them checked, and then once we've checked them, what we tend to do is we make a plan of what we're going to do next. We've got a couple of options. The first one is we do fine needle aspiration, which is basically a needle biopsy. So pop a needle into the lump and then aspirate the contents onto a microscope slide, send it off to the lab to be analysed. It's accurate about 70% of the time because we're taking such small samples, but these are samples that can be taken while the animal's awake. They don't need to be sedated. Sometimes, unfortunately, if the animal isn't very happy with us, poking with needles, it's not particularly nice, is it? Then what we tend to do is we give them a light sedation and we do an actual biopsy, which is where we actually take a piece of tissue out. So if you have a look here at little Bo, she has had a biopsy today of this little lump on her back leg. So we were not sure what it was, so what we've done is we've given her a nice sedation, so she's been nice and asleep, and then we have popped some local anaesthetic around the area, and then we've actually taken a sample of the actual tissue. So we will get a result of what that tissue is for definite, and then all we've done is just popped a couple of little stitches in there, so it's nowhere near as big as if we were to remove the whole lump. If we were to remove a lump first without checking what it is, we might not have removed the whole thing. So the lab will tell us if it's a particularly nasty lump, they will say you need to take margins, you need to take an area of skin around the lump itself to make sure that it hasn't spread already. Definitely worth coming to the vets and getting them checked out.